So, for example, if a woman is diagnosed with endometriosis, endometriosis is an autoimmune disease that affects the reproductive organs and can affect actually the internal organs as well. What happens is that the immune system goes haywire a little bit, and when it's triggered or stimulated, the body attacks itself and it causes scar tissue to form anywhere in the reproductive system. It can also cause scar tissue to cause the intestines to attach to each other. It can cause other organs to attach to each other. It can be very serious. Typically, 50% of the women with endometriosis will experience some degree of pain with their menstrual cycle and heavy bleeding and clotting and cramping and things like that. Many women suffer greatly. They rank it in stages from stage 1, 2, 3, 4 in terms of severity. And women with stage 4 endometriosis, don't go to work on the day that they're having their period. That's how much pain they're having. And so when we're working with patients with that, again, we're looking for what are the common symptoms and how do they present in the menstrual cycle, because we feel like the menstrual cycle gives us information about how to help people. It gives us information also that we can measure each month, and that's really valuable because what we're interested in doing is making programs for people that actually produce change. That's what we're really interested in. And so the main characteristics is you'll see there's a lot of inflammation with endometriosis. So a really important factor is that women get on a diet that's very low, has a low amount of inflammatory foods in it. But what you'll also see in the menstrual cycle is that there'll be elevated temperatures. So in the first 14 days, where we like them to be around 97.2, they'll be significantly higher. They usually have normal progesterone levels, which is good, so there's one less thing that we sort of have to address. But when those temperatures are high in the first part of the menstrual cycle, that impacts cervical discharge. Right? That small change from maybe 97.2 to 97.8 is enough change in temperature to dry up the cervical discharge. And the higher that the temperatures get, the drier the cervical discharge gets. And without cervical discharge, you cannot get pregnant. Cervical discharge is the ladder in which the sperm swim up to be able to get through the os of the cervix into the uterus. And so if the cervical discharge is really gooey and pasty, it doesn't form that ladder, and there's no access for the sperm to actually get into the uterus. So it's really important. And so then we have to look at the bleeding, because this is the other factor. So when women have very heavy bleeding with a lot of clotting and cramping, we know that the blood flow through the uterine artery into the uterus is compromised. And so then if this is the inside of your uterus and the blood that it's producing for the menstrual cycle or for preparation for implantation has a lot of clots inside of it, well, even if the woman and her husband are fertilizing a perfect egg every single month, but that egg is implanting where the blood is very clotty, then there's no live blood supply there. So it really decreases the likelihood that that woman can conceive. And so then we want to look at the bleeding phase of the menstrual cycle for women with endometriosis. We want to help them to regulate blood flow through the uterine artery and through the uterus so that they're producing fresh, healthy blood and a fresh, healthy uterine lining. This extends beyond just getting pregnant, though. This is a really important factor because when there's a lot of clotting and hemorrhagic bleeding, what also tells us is that remember that the uterine artery has to help produce the placenta. And so if you can't make a good lining, then we also wonder what's going to be the quality of the placenta. It's through the blood that we produce, the quality of the blood that we produce, that we are delivering nutrients to the developing fetus. And so if that's compromised, this also impacts. Remember, our goal at Conceivable is not only to help people to get pregnant, but to deliver a happy, healthy baby. And each part of that is critical, from the very beginning stage to making sure that the blood production and quality is high all the way through the pregnancy until delivery.